Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Jody James with Essential Hospice. Good morning.
Hi, good morning. I'm so happy to be here with you. Thank you for having me.
No, I'm super excited for you to be on because we're going to talk about palliative and hospice care and what's the difference, because there's a difference in, when you start to get older, there's a lot of things that we just don't know. So we always want to make sure that we try to give our listeners as much information as possible. So let's start with palliative care. What
Sure.
is it and when is it appropriate to use?
So, palliative care is a specialized medical care for people that are living with a serious illness. This type of care is focused providing relief from symptoms and the stress that come along with having a really serious illness. A lot of people experience anxiety. They have a lot of pain. Oftentimes they might need um, more of a spiritual care. So that's where palliative kind of comes in. And you can get palliative care at any stage of your illness from, the very beginning. Maybe you're in the middle and your illness is getting worse and you are finding that you need more care than what you're being given. But we often work with their main providers that help them with their illness and try to make sure that we're helping improve the quality of life for the patient and the family.
Okay, so I'm going to dig a little deeper. So, because I'm going to ask you to be a little more specific for me when we're talking about like the ideal candidate for palliative care. What does that look like? Is there types of, diagnosis, things like that, that kind of would help our listeners know, oh, wait, I need palliative care?
So a lot of times we see people that have cancer, or
Mhm.
maybe they're dealing with cardiac heart issues or kidney issues, and they are still using what we call aggressive treatment. So, with cancer patients, that's going to be chemo, radiation, things like that. And with kidney patients, they could be getting dialysis. Um, so, palliative care allows you to still be able to get those treatments and, um, but get help for the anxiety, the stress, the pain that come along with those treatments. Um, so in hospice, I guess we can get into that too, is a little different considering that's part of our name. And that is actually the main focus of what we do. But the palliative care means you can still be getting all of the same treatments that you're getting, but we're going to come in, we'll send a nurse to come out and evaluate you, and they will work with a team, a doctor, our medical director, and a social worker, and also a chaplain. And so we can decide at that time when we're speaking with you what services you might actually need as part of your palliative team. Some people come on and they might see the nurse and say, hey, I'm having a lot of anxiety and I'm also experiencing a lot of pain. So I just want to treat those things. I don't think I necessarily maybe need a social worker. Um, or they might just come in and say, hey, I really think that I'm having a lot of you know anxiety, and it's more of a spiritual problem. So maybe it would help me to see a chaplain, so we can provide a chaplain to come in and help with those needs.
So, having said that, and so how is hospice care different? What's the focus?
Sure. So hospice is helping patients that are at the end of their terminal diagnosis. So they come in with a prognosis of 6 months or less, eh, as of a time frame for living. So obviously, we're not psychic and we don't know exactly when that's going to happen. But usually it's when a doctor tells them, hey, you have reached the end of your curative treatment process. Like you don't really have a lot of options left. So we come in, and I know that a lot of people think, oh, maybe I just need to get on hospice when I only have 3 to 4 days left to live. And honestly, the sooner you come on, the sooner we can help you. So, hospice provides a much bigger variety of services for a hospice patient. So, we'll come in and we provide um, durable medical equipment as well as supplies, all of the medications. Um, I'm sorry, I'm saying a lot, but we also provide all of the core services like a social worker, a chaplain, nurses, and we have a doctor that oversees everything. But the main part is we also provide certified nursing assistants. So they can come in and help, get the patient bathed and dressed and fed. And that service can be provided for 5 days a week, but it's also up to the patient. They can have no services or they can have as many services as they want. So we also take care of patients wherever they are. It could be their home where they live alone, or maybe they live with family members, um, or a nursing facility, assisted living facility, and we go all kinds of places. So we try to meet people wherever their needs are.
So you talked about a bunch of different types of people that work in the company. You talked about a nurse, you talked about a CNA, you talked about a chaplain and a social worker, doctor. Is the same team on hospice and palliative, or do they differ depending on whether you're on hospice or palliative? And can you kind of describe how the who goes where and what's the difference?
So in palliative care, you're not going to see as many members of our team. So we do not provide a CNA. We do have a nurse, and they will come in and assess what they think the patient needs. So, say, they're at the beginning of their illness process and maybe they don't need as much help, so they just go in and they'll tell them what's the nurse what's going on, and at that time she'll ask them, do you feel like you need a social worker, maybe need some counseling, and we can help set them up with that. Maybe they need some help verifying things for their insurance, or maybe they services like a Meals on Wheels type of program and things like that. We can have the social worker reach out and get them those community services that they need. Um, we also have a doctor that will assess, what type of maybe pain medication or something that we can give them, anxiety medication that will help ease their stress and their anxiety, and the burdens that come along, with that, having that disease. And that is the primary focus, just kind of comfort and helping them with that during the palliative care process. Now, in hospice, when we come on, that's when there is so many more services that we provide, because they are no longer getting aggressive treatment. So they're not going to see their doctors that they were seeing along in the different stages in the beginning of their disease process, when they were having more of a curative care plan. Um, so we come in and we talk with the family and the patient. We see what they need. If they need um, a bed that is gonna, help lift them up and out. If they need a Hoyer lift, any kind of medical equipment that they need, we will come in and provide. If they need a wheelchair, maybe, they can't get out of the bed. So we will determine all of the different supplies and things that they need, and we provide that as part of hospice. Um, and then we also, like I said, have the CNAs who are very crucial in coming in, and that's probably the person that they're going to see most, depending on how much help they need. So we also have the chaplain, the social workers. They'll see a nurse more frequently with hospice care than they will on the palliative care. And we have a 24-hour helpline, that you can call in, and someone is always going to be available 24/7. We know that, people don't just need help between 8 and 5. So we are always on call, always there to help, no matter what service it is that you need. We also have a strictly Spanish speaking care team that can come in and help, because being in Texas and not too far from the Mexico border, we have a lot of people that come and they just speak English, or just speak Spanish, and they don't speak a lot of English, or very little. So they might have a family member or something um, that is trying to translate. So we have a team that will come in, we have forms and everything, so that they know they are getting a a team that is really helping them, and they can understand what they're getting, and we can understand what their needs are. And we don't just try and help the family. We know that after our patients have passed away and they're gone, we still provide bereavement services for the family. And we have some people that might say, oh, we don't need your help afterwards. We're dealing with it on our own, and that's totally fine. And then we have people that we may remain very close to for years and years. And we've watched children grow up, and I've had a lot of people. Actually, we had a child that was um, one of our very first patients. They passed away, and the child ended up coming and volunteering for us for a little while. And so it's just nice that we can, keep in touch with families. And I think that people don't understand, like, that there's so much more to hospice than just dealing with the medical stuff. I think the emotional and the bonds that we create with them are really special. We're getting allowed into someone's home, um, and being a part of their family and lives at a time when they really need a lot of help. So, we're very blessed and honored that people allow us to come and help them do that. And so we like to keep in contact with them well after their family member, their loved one is gone. So we can keep keep having that family flow, and you know it's just a good feeling to be able to help people. So that's the main focus of both palliative and hospice care, just helping people get what they need.
Yeah, we found the same issue as far as needing Spanish speaking people in the office. So I can appreciate that. So I've got an attorney, legal assistant, the receptionist, so there's more than just one, which is very helpful, in that aspect of it, because we like to meet people where they are. And, so as much as possible. And I'll give you a tidbit. So when somebody's listening to this, they get it as well. Word actually translates into, I think, 148 different languages. So if you've got one of the newer versions of Word, you can translate it to any language you want, and it's pretty good. So, and somebody gave me that tip, so I've always passed it along. And so,
That's great. That's definitely helpful. Well, we also have something called the language line. So if we have someone that speaks a different language, and we don't have somebody that can help them, we call that line, and then they help us communicate with the patient or the loved one, so that there's no barrier in between us, and we can use that every single time we have a visit, if we're doing an info visit, or actually in the home helping the patient. The nurses, the CNAs, everybody can use it, so that's also really helpful tool.
oh, definitely. So, all right. Is it true that people on hospice live longer than people that are not on hospice?
Surprisingly, that is very true. But I think that, again, people don't realize all the services that we do provide. So once we're able to get in there and actually help the family, being a caregiver is extremely difficult. It's exhausting. And we offer something in hospice, also another service, which is respite care. So, say a family member needs to go on vacation, or they just need a break because they're tired. We can actually get the patient, if they need an ambulance, or even if they're wheelchair bound or they can walk, we get them transported to a facility where they'll stay and be taken very good care of for 5 days, so that family can, get some rest. So we have all of these services. We bring these people a lot more comfort, a lot of care. And, maybe it was someone who was living alone and they were trying to take care of themselves the best that they could. But having us be able to come in, help get them the medications they need, get them a bed that's more, helps them be more accessible. It's just a lot of different things that are kind of involved with that. And the better the care they receive, like the longer they do seem to live. And I know that there are so many people who have loved ones that take such good care of them, that they hang on, and they hang on for a long time. So we've had people who come on to hospice, and they come at the very end, and we're able to just get them home, get them comfortable so that they can pass away in a place that is, comforting to them. That's where they wanted to be, with their family. And then we have people who have, we will think, oh gosh, they're, probably not going to make it a week. And they're on for 6 months or 8 months. We've had people on for as long as a year or more. And then, instead of seeing them decline, they get better, and they've actually graduated from hospice, and they don't need us. And we'll say, well, when things get, bad again, you need us, like, let us know. And so it's kind of amazing to see how many people do actually, you know, come off, or they stay longer than 6 or less. So, it's, everybody is different. It depends on the patient. And, but yeah, they definitely tend to live longer. They stay out of the hospital, which is, um, another huge part of palliative care and hospice care. The goal is to keep them out of the hospital, to keep them at their home so that they're comfortable, they're with their loved ones, and they're not having to experience those long hospital stays.
So I think some of our listeners would probably benefit really quick from knowing uh, Medicare pays for these services.
Yes, absolutely. Medicare and even Medicaid, depending on, what they have. So, Medicare is a great resource, but we know that not everybody is of Medicare age. So, there are a lot of private insurance companies that will pay for these services as well. And so we just always ask everybody to, they can either let us know what insurance company they have, and we can kind of do the legwork for them and call them and find out what they qualify for and what they don't. Um, we have social workers that can help them get on Medicare or Medicaid if they don't have these. And, that's another big help, because some of it is so hard to understand. Like when you're trying to fill out all these forms, and people are asked questions that they probably haven't thought about, or maybe, they had a spouse that took care of all of that for them, and now they're having to do it for themselves. So it's a big help to have someone who knows what they're doing, who can walk you through it. And we actually, like, kind of stay with them through the whole process to make sure that they get approved and get all the documents and things they need turned in.
Perfect. So, Jody, if somebody wants to contact you for palliative or hospice care, how do they do that?
Well, they can always call us. Like I said, we are available 24 hours a day. So just give us a call at 832 224-4756. Charlie Lane is amazing. She's our intake coordinator, and she is truly amazing and wonderful. And she's the most comforting lady and so sweet that you'll ever meet. And we always say she gives good phone because she is just ease and comfortable. And she has been in hospice for 20 plus years and knows all of the ins and outs, and will definitely be able to answer any questions that you have. Of course, I can reach at Jody at essentialhospice.com, and Jody is Jody. Let's see what else. We also are on Facebook. So I think we have the link. Maybe they can put up there, but you could just search us at Essential Hospice and Palliative Services, and it should pop up. I don't know if you could see the logo on my shirt, but it will, that's the logo on our Facebook. So we hope that you guys get in contact with us because we would love to help you.
Perfect. Jody, it's been great having you on the show today, and we look forward to having you on the show again soon.
Thank you so much, Kim. I appreciate you, and thank you for all that you do for the community. You have great services, and you're a wonderful person. Provides so many.
Well, thank you, and I know what a good job y'all do as well. So thanks for being on the show.
Thank you.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcasts as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.